Hi, everybody. Dr. Busy Riley here, coming at you live from isolation in my office. I wanted to talk about something that I get a lot of questions about in my practice when we start to address hormone replacement therapy, and that is hormone replacement therapy bioidentical, and what does the word bioidentical mean? I know that I'm often a very disappointing naturopath to people because sometimes I do use pharmaceuticals in my practice, and I want to clarify that you can have pharmaceutical hormones that are bioidentical. Bioidentical means chemically identical to the hormones that we make in our bodies. Our goal is to try to replace the hormones in the least invasive way possible, and to me that means using the hormone that's identical to what we would be making if we had not lost our hormone production in menopause. So bioidentical means chemically identical, but that doesn't always mean compounded. Compounded means that you use a compounding pharmacy in which you can manipulate the source of the hormone and all the fillers and the delivery mechanism. So for me, when I start hormone replacement therapy with most women, when we're talking about estrogen and progesterone, I actually start with basic, good old pharmaceutical hormone replacement therapy. So it's bioidentical, but it's not compounded, and it usually can come from just your standard pharmacy. A lot of times I will start with a delivery mechanism like a patch. Typically patches with hormone replacement therapy with estrogen, the patches tend to have fewer side effects as far as libido is concerned. And I typically start with an oral progesterone capsule that does come from the pharmacy. And the only time I don't start with an oral capsule of progesterone is when somebody has a peanut allergy, because there is some overlap there with the type of hormone that's used in the pharmacy. The reason I start with pharmaceuticals, most people will get insurance coverage for it, so it's a little bit less expensive. And also because it's easier and the delivery mechanisms are easier, and you can usually order a few months at a time. So I don't have any problems doing that. But if people don't like to use something from a pharmacy, we can certainly compound hormones at a compounding pharmacy, and there are a lot of great ones here in the Seattle area that I use. The one hormone that I don't use from a standard pharmacy is testosterone. I always compound testosterone. The testosterone delivery mechanisms that you can get just from a standard pharmacy typically don't work that well. They're not very consistent, and they're not very compatible with absorption and utilization in the human body. They're like alcohol-based skin gels, and our skins typically don't absorb things in an alcohol base very well. So that's the only time I don't use that. So when you hear the word bioidentical, remember that all it means is that it's identical to the hormone that you make in your body. A compounded hormone is something different, but you don't have to have a compounded hormone to make your hormones bioidentical. I'm Dr. Busy Riley. Take your hormones like you give a damn.